Facebook Live is our friend.
Okay, it's doing it. Okay.
There we go. Looks like we're live on Facebook, everyone. Welcome. I'm Kim Martino Sexton, and I'm here with Elizabeth Louder, and we've got two guests today. We're going to talk about an investigational study of a medication for postpartum depression. I might be languaging. We're going to actually, we have the folks here today, Carol Poupard and Jenna Collins-Reed, who are going to help us actually talk about this, because this is new, exciting, and we want moms and providers to know what's happening in the world of medication. I still find it amazing that here we are in 2020, and we're talking about an investigation into a new medication, knowing that women have had postpartum depression and anxiety forever. And so, finally, we're going to talk about looking at something specific for women, which is unusual in the pharmaceutical world, right? This is not something we do very often. So here we are, cutting edge, live. And so, Jenna, let's have you introduce yourself, and then Carol, introduce yourself, and then we'll continue this conversation.
Okay, I'm Jenna Collins-Reed. I'm a licensed clinical social worker, and I work with Dr. Syed with Arch Clinical Trials in long-term care psych, and I have a history of working mother-baby at a local hospital in St. Louis. And so that's why Dr. Syed approached me to get in touch with your group to let everyone know there is a Skylark postpartum depression clinical trial starting in St. Louis. It is the requirements to participate. The patient must be 18 to 45 years old, have given birth within the past 6 months, frequently feeling extremely sad, anxious, overwhelmed, because these are all symptoms that are associated with postpartum depression. These symptoms had to have begun no earlier than the 3rd trimester and no later than the first 4 months following delivery. So you could be home doing fine for a couple months, and all of a sudden month 4 hits when you're trying to go back to work and postpartum depression hits. That is when you are definitely in the window to be a candidate to participate in this study. And I'll share one more thing before we really get started here. And I was asking myself, we were actually talking with the group about why participate in a clinical trial when, sometimes you can go to your doctor and get a antidepressant. And this is a question I really thought about myself, but clinical trials give people hope. And this is a way to get the newest medication available on the market. And this trial is short. It's a 14-day trial. And it's, I believe Dr. Syed had told me, the 3rd stage. So this is not like the first round with this medication. It's getting to the point that it will soon be on the market. They are very confident with this specific medication that does not yet have a name. So anyway, I think, it offers hope. It's a way to get the newest medication that's out there. It's also a way to be part of science. It's a way to contribute to science and contribute to the medical advancements that are made here in the United States. So with that being said, I think that's, that gives people a reason to say, I think I would try this,
I think it's key, Jenna, to that when you talk about that 3rd stage. And so, most of us out here in the regular world, I consider myself, I'm non-clinical. I know nothing about medication, or, I know what I know, right? From reading. But as a non-clinical person, when you say something like it's in the 3rd stage, I'm like, oh, well, how many stages are there? And so that we're going through before we get to market. So it's important that, okay, well, we've cleared the first 2, we're in the 3rd stage. That's awesome. How many more stages are there?
That is, that is dependent upon the drug itself and the company. It usually starts out as, like in mice, and the first couple of phases are the first phase. Now I can tell you that that we've shown where it's been beneficial, often by the third day, for treating postpartum depression, that they're seeing some of the symptoms abate as soon as 3 days. So that's why now they're honing in like on dosages. So that's what they're trying to work on at the moment. So that, once again, they are very, very hopeful about this medication.
That's
That has
exciting.
And there is a placebo medicine also, but again, the whole trial is 14 days. So if you are given a placebo, or you really won't know, if you are not getting the effect of your postpartum depression symptoms diminishing quickly, these doctors, group of psychiatrists, certainly have other medications to give you, so that you are not out there having postpartum, on your own. This is not like, this is a clinical trial, but you also are very supported.
Okay, good.
And that's important. That's
Yes.
so key to know that there's a lot of support. So if a mom is, if she's experienced depression towards the end of her pregnancy and is experiencing the symptoms of depression through her 4th month, is that what you said?
Yeah.
Postpartum.
Mm-hmm.
So she then would be a good candidate to be a part of this trial, this
Absolutely.
clinical trial.
Absolutely.
And in terms of accessing this clinical trial, does she have to go to her provider, or does she just call Skylark Study?
Right.
Look at that. There's
She can
numbers right here on the back.
certainly call this study. Kim, if there's a way to contact, on your website, to contact you or Elizabeth, I have offered, and I cleared, Dr. Syed and I have talked, they can certainly go, contact you, go through me, and I can help do a real warm handoff there and answer any other questions. Also, certainly just call the Arch Clinical Trials, and there's a website and there's a phone number. Should I say the phone number here?
Yeah, you
live?
can, and
Yeah,
we're
you
gonna
can.
and we're gonna put it in the comments too.
Okay, so the phone number for Arch Clinical Trial with the Skylark Study, 314-282-3521. And this is at 2639 Miami Street, 2 West in St. Louis. And then again, if someone would prefer to talk with someone first and do a warm handoff, my information will be available there. Hopefully, Kim, through you or on the website also, and I am very happy to help.
Yeah, we'll make sure that your information, Jenna, is in the comments for this video.
Okay.
And so, one of the things, like, for as I think about this and try to get this straight in my head, I have this excitement about the possibilities for having a medication that women can take that's specifically tailored to the female body, to work specifically on something that so many moms struggle with.
Right.
And then, what pops into my mind though is like, okay, well, here we're asking a postpartum woman, can she breastfeed? And so can we talk a little bit about that? Like, what?
Because a lot of moms are concerned, obviously, about the medication they take when they're nursing.
Right. And that's something that this study is taking in mind. And so what they are requiring is that before beginning the very first medication, ingesting the first medication, that the mother stops breastfeeding. However, they recommend, there's a lot of benefits to breastfeeding. If it's something that the mom would like to continue doing, keep pumping and use a breast milk bank milk in the time that you're participating in the trial, and also for up to, I think it's either 14 or 30 days past the last time you take the medication, so that the medication can get in your body and out of your body, and you're using the blood and you're using the breast milk bank. Clinical trials also will help in supporting you financially in that endeavor, because we also do value moms that breastfeed. There's a lot of benefit to it.
So to clarify, you'd probably need to be pumping and dumping for a minimum of 4 weeks, and the study would help you obtain donated breast milk from a
Absolutely.
bank.
And it's probably
Okay.
closer to 6 weeks, I think.
Yeah. it
Okay.
is.
Okay.
Yeah.
That's important to know, because to know that
Absolutely.
you'll be exclusively pumping and dumping,
Yes.
or need to wean, or whatever it is that you just, that mom decides to do, but
Yes.
that's a 6-week window. That's
Right.
because that's okay.
Mhm.
And I want to clarify something I might have misheard, or somebody might have accidentally misspoke, but people who have given birth within 6 months can apply for the study. I heard somebody say 4 months.
No, well, it is 6 months. There
Okay.
has to be, and it may be helpful if I just, sort of, go through this all, point by point.
Okay.
But the symptoms have to have occurred in the last trimester of the pregnancy and up to 1 month after giving birth.
So symptoms appear
They started displaying
a month before or a month after birth. Right. But then if if that's true and you have a 6-month-old, you still qualify.
Up until 6 months.
Got it.
They do qualify for the study.
Okay.
So, and I probably should take this time. I'm Carol. I'm with.
Hi, Carol. Thanks for joining us. Thanks for introducing yourself.
I'm the clinical director for long-term psychiatric management and clinical medical services, but I also assist with Arch Clinical. And just to kind of give you a rundown how Arch came to be, Dr. Syed, who's a board certified psychiatrist, took over long-term psychiatric management, I think back in 2007. And he has grown this practice to include inpatient, outpatient, and several hospital programs, as well as covering the underserved in more than 78 facilities throughout the state of Missouri. Then in 2015, again, seeing a need primarily for the underserved, we brought on medical, and that's our clinical medical service.
Mm-hmm.
And then late in 2017, Dr. Syed decided that he was going to start a new phase of trying to help patients by advocating medicine through research. Thus, that's how Arch Clinical came to be and how I came to be with you all today.
Mm-hmm.
So, and as Jenna has already touched on, this is the Skylark Study, and it is for adults with severe postpartum depression. Now, whether that's been diagnosed or not diagnosed, I think they've already touched on that as well. If you're experiencing any kind of, depressive symptoms, you can certainly call the study. You can reach out to your provider. Arch Clinical will work closely with your provider, in any way that makes the volunteer and the provider comfortable.
So just to clarify, can I jump in with questions as you clarify? So
Absolutely.
You don't have to have an existing diagnosis.
No.
But you can be presenting with symptoms, and then you guys will figure out if that qualifies for a diagnosis
Absolutely.
or not.
And that's part of the lovely 30-page consent packet that the volunteer would get, if they so choose. There are key inclusion criteria, that starts this out. And I know Jenna's already spoken that it's, for women 18 to 45, that they are less than 6 months postpartum, but their symptoms occurred either in the last trimester of their pregnancy or 1 month postpartum. And they have scored, and this again would be part of the consent package, they would score greater than 26 on a HAM-D, which is a depression scale. And that HAM-D is used extensively throughout the entire study, should they become eligible for that. And as she stated, they do have to agree to temporarily cease breastfeeding. Now, along with the stopping, breastfeeding, should it be the breast bank, I think is what you called it?
Mm-hmm.
Breast milk bank.
Yeah.
Mm-hmm.
or if they have to supplement with formula during this process, or, even, the breast pump itself, all that could be reimbursed by the study. And there also, the study has lactation specialists on hand, to help through any part of that process as well. There are some key exclusions. Now, and again, if you look at the 30-page consent, there are lots and lots of inclusions, lots and lots of exclusions that I won't bore you all with right now. But the key exclusions are obviously the volunteer cannot be pregnant. They have to agree to not get pregnant throughout the course of the study. That they're not experiencing active psychosis. That's a big one. They not a suicide attempt during the current course of postpartum depression. Now, if there's a history of it, but just this current time, suicidal ideation would not be an exclusion.
Okay.
And there are other history of seizure disorder that generally rules out anyone participating in a clinical trial. Also, in this particular one, if they have a history of bipolar, schizophrenia, or schizoaffective disorder.
They are not qualified, or that they do?
They are not, they would not qualify.
Okay, that's important to distinguish, particularly for moms that Kim and I work with. So if you have a bipolar diagnosis.
Bipolar, schizophrenia, or a schizoaffective diagnosis.
Can you explain in one or two sentences why that would be the case? I'm I'm speculating, but just to clarify.
Well, and I would, while I, can't, officially determine why the study has chosen to exclude those mental illnesses, but seeing as one of their key exclusions is psychosis. Oftentimes with those three diagnoses, psychosis is involved. And this one is really, it appears to be really focusing on depression and anxiety.
Mm-hmm.
So
it's going to help clarify the research results, I would assume, right, if those pre-existing conditions aren't present.
Right.
Not that moms with those diagnoses don't deserve or need support or help. I'm the therapist lady. I got to say stuff like that.
Please do.
I'm just thinking of the moms that are watching. Mm-hmm. All of those moms deserve support. There are other treatment options. Call the mom's line.
Yeah.
Call me or Kim.
Yeah.
But this is a official medical, registered, licensed, whatever the terminology is, study, and they've got to get clear results. So that would kind of muddy the water, for lack of a better term,
right,
with the results. Is that safe to say?
That would be perfect to say.
Okay. Thank you.
So, and the study duration is 76 days from consent to the end. The first 28 days is the eligibility period. So a volunteer would agree to want to participate. So they would sign the consent. And then from that point, during that 28-day screening time, the volunteer would receive a physician exam, labs, an EKG, interviews with Dr. Syed and our board certified clinical psychologist. And then during that 28-day period, once it's been determined that individual does in fact qualify, then they would start the 14-day medication. They would take it, I think it's once a day in the evening is how they have that dosed out. So, and as Jenna said, for 14 days only. And then after that time, there are 4 follow-up visits in the clinic where, again, the HAM-D and other interviews, to determine the efficacy of the medication. Volunteers could be compensated for their time and effort coming, to each visit. They certainly will provide transportation. The study also, we've already talked about how they will take care of, a breast pump or formula if the volunteer has to stop breastfeeding. Also, the volunteer is welcome to bring their baby to every one of the clinic visits, and there are 9, I believe, total, 9 times that they would come to the clinic. So they're certainly welcome to bring their baby to those clinics, those clinic days. Should other childcare be needed, the study will reimburse volunteers if they have other children at home that need to be cared for while they go to their study appointments.
Well, that's just, can I just stop you right there? Because that's
Please.
just, that's fabulous.
Mhm.
Often that's one of the most challenging things about getting moms involved is that we don't have childcare and we don't allow her to bring the baby. So the baby's allowed to come with you. There's reimbursement for childcare. I heard you mention transportation, that there's 9 visits. Even for me, it's like, wow, so they're really paying attention and supporting you and listening to you and, making sure things are going well for you. So
Right.
It sounds really well cared for, that the volunteers would be really well cared for. Sorry,
Right.
Carol, just wanted to
Oh, no,
point that out because that's fabulous.
That's special. Yeah, that doesn't happen all the time.
Right. So they will come and pick the volunteer and their baby up if need be, or reimburse them for any travel. So that's, and, we've already identified how, should you like to participate, you can certainly, call us directly. I like Jenna's warm handoff. I would also certainly offer myself up for another warm handoff. So really any way that, we can try and reach out and get help for people suffering from postpartum depression, we sure like to try.
It's awesome.
Yeah. Well, thank you. This is wonderful. I know that, in my head, the questions that I had are answered. I don't know if there's anybody watching who's posted any questions. Unfortunately, I can't see that.
Yeah, no, not yet.
Not yet. And so I know that questions will be coming up as we post this. And we'll do our best to manage those questions, be reaching out to both Carol and Jenna to answer those questions, even tagging you in posts if you'll allow that, so that we can get questions answered. For me, the trying to figure out what a clinical trial looked like. So thanks for describing that. That it's this many days, that you take the medication for this many days. But I love that there's the 28 days of really validating and figuring out if you're right for the trial.
Right.
So I like how much, detail and how much wraparound care there is just to figure out if you're ready for the trial. And then if you do qualify for it, and then all that care that takes place for 76 days afterwards, or total of 76 days. I can't do math, so forgive me. But, but I do think wow, so it's not just here, take a medication and call us the next day. It is, we're keeping up with you. I love that there's a psychologist, psychiatrist involved, that you have lactation support available. I mean, all of this sounds very mom friendly, as it should be. And so
it sure is.
That's wonderful. Well, we've got 3 minutes left. We asked you guys to join us for 30 minutes today. This has been so informational. As we start to wrap up, though, is there anything that you think we should know, or clarifying points, either Carol or Jenna?
One thing we didn't mention that I really did clarify with Dr. Syed is that the mom does need to have a negative urine drug screen. So unfortunately, heroin, or, methamphetamines, for sure, it's not going to qualify to participate, just because they really need to clean urine drug screen to see what is helping. And if someone's on drugs, their emotions, it wouldn't be a true, accurate result read. Yeah. Right now it's a no for marijuana also. But I did talk to Dr. Syed about that, you know, and we're looking into that further. But because I know so many moms are using that right now, but right now we're going with a negative urine drug screen.
Okay.
And, you know, and certainly, if a volunteer is taking any, medication, or, they've had a past history, they're welcome to call and ask Arch Clinical any questions whatsoever. You can simply, just say that, you were part of the Facebook Live and you have a few questions, or you can, if you don't want to call, you can use our website, archclinicaltrials.com. Ask any questions that you'd like. We aren't, you won't be monitored. It's, it's just, you can ask all the questions you want, and please feel comfortable and free to make any of those questions, as personal or not as you need to.
Okay, cool.
Yep.
It sounds like you guys are really receptive to those questions and want to clarify who's eligible and who's not, and so that we can get the people that need the support in, and you can get some good results so that we can help en masse way more moms, which
Right.
is the mission. Yeah.
And providers too, right? So if we've got providers out there that have moms that they think would be, would be a good volunteer for this study, they can also reach out. Not only can they give the information, but if they had questions, Carol and Jenna are making themselves available to clarify with you as well. And so, because sometimes our providers, you may be working with moms and you're thinking, hey, this is a possibility for her, but you want to get some questions answered.
Right.
So
You're right, Kim. And we may have some other options through what Dr. Syed offers is, we may have some ideas. So it would be a good idea to run it by us.
Okay, good.
Wonderful. Well,
Thank you so much.
Yeah, we're at our ending time here. So thank you, Carol and Jenna, for joining us.
Thank you.
Thank you. Thank you for what you do.
Thank you for what you do for this community. It's amazing.
You are welcome. We'll be sharing this, and anybody who has questions, we'll have all that information in the contacts. So Elizabeth's going to make sure we have that. And so thanks everyone. And in the comments, I said contacts. We'll have the contacts in the comments. I don't know. I think I know what I'm saying. All right. Well, thanks everyone. It was great to be with you all today. Take care.
Stay safe.
Bye-bye.
Bye.